So I would say welcome, Emma, to the LCaS forum. I think it may be your first time here.
Thank you.
We are registered managers across all the sector. So it's from all specialities, dom care through to care homes. So I think we're all here to really see what CQC have to say. So thank you very much for joining us.
Okay, have you got the slide? Have you got the slides?
Yes, we can see the slides now. Thank you very much.
Okay.
Okay, so thank you very much for inviting me to come and speak this morning. I'm Emma McFarlane. I'm one of the inspection managers and I work in adult social care in London. So I work across a bit of South London and a bit of North London, so I might have come across some of you before. So if I could have the next slide, please. So what I plan to talk about this morning, I have got quite a few slides, but we'll just see how things go in terms of time and what would be most useful to talk about. But the things that I'm planning to talk about this morning is, first of all, to talk a little bit about CQC's new strategy, which came into action this year. I think that will be helpful to give a bit of context and background to our new monitoring approach, because I'm sure you're all aware CQC this year has changed or is in the process of changing our approach to regulating services. So I will speak a little bit about that. And then I'm going to talk a bit about vaccination as a condition of employment, which I know is a hot topic at the moment. And then if there's time, I'm very happy to take questions. But if there's anything that I can't answer, because obviously things are changing so rapidly at the moment, so I'm not going to promise that I've got all the answers. But if there's something that I can't answer, then I will I'll take things away and come back to you. Okay, so could I have the next slide, please? And I think actually the next one after that, please. Thank you. Okay, so as I'm sure you're all aware, we launched our new strategy earlier this year. And so there is a lot of things that are changing at CQC and in the way that we regulate. But the one thing that isn't changing is our purpose and our values. So, you know, we exist to ensure that people receive safe, effective, high quality healthcare, and we want to encourage services to improve. That's always been our purpose, and that is remaining the same. But as we're all well aware, there's been huge changes in the social health and social care landscape since 2016, when we published our last strategy. And all of that has been really accelerated by the pandemic. So that's affected the way that providers have had to work, but it's also affected the way that we've had to work at CQC as well. So we are changing to become hopefully more adaptable and more responsive to where the risks are in the system. So, you know, we always had a program of inspections where we visited services according to what the rating in those services was. You know, we then had that rolling program of inspections. And in order for us to be able to get out to visit all services in the way that we did before, we just have no longer got capacity to do that. So we have to be able to respond to where risks are in the system. So that is a real driver for changing the way that we regulate. So if I could have the next slide, please. Okay. So we did a consultation before we implemented this strategy, and some of you may have been involved in this consultation. So we consulted with a range of members of the public, service providers, and other stakeholders as well. And from the consultation, we found that overwhelmingly people were in support of our ambitions and for our kind of strategic vision, but there were concerns, of course, about the things that we are planning as well. So mostly people were supportive, or people who took part in the consultation were supportive of our ambition to increase our ability to get people's experiences of care services and to speak to people who use services. And people generally welcomed the focus on CQC working more closely with services to really build strong relationships and drive improvements in care. And there was a lot of support for our ambition to really improve our use of data, so to make sure that we have up-to-date accessible information to be able to target our inspection activity appropriately. There was, some concerns about how would we be able to implement this strategy? Would we be able to implement it? There was a lot of concern around whether or not we would still be conducting site visits, so crossing the threshold of services, and that is something that we continue to hear. And just to reassure you that we absolutely are continuing on-site inspections. That's a really important part of how we regulate. But of course, it's not the only way that we can regulate, and it's not the only tool that we have. So I will come back to speak about that in a bit more detail when I speak about our new monitoring approach as well. There was also a bit of concern about whether this would actually mean, this new way of working would mean more work for service providers. And one of our overall ambitions is actually to minimise unnecessary workload for service providers. And we certainly don't want to be duplicating the work of other regulators. So we want to work more closely with other regulators. But we also want to look at how we're using our data to use it in a better way, so that we can collect data once and then we can use it again, rather than having to request the same information time and time again. And one of the key themes that runs through this new strategy is about reducing health inequalities. And that was also something that came out of the consultation. People were wondering actually how we were going to do that. So I suppose one of the things that has come out of the new Health and Social Care Bill is it does change some of CQC's powers. So we are going to be able to regulate integrated care systems, which is obviously a fairly new development. And we're also going to be able to regulate local authority commissioning. So if you think about a whole system approach, we know that sometimes there are problems in care services which are actually completely beyond the control of that particular service, because perhaps it might be to do with a commissioning decision regarding a particular placement that might be inappropriate, or it might be to do with the amount of commissioned care hours, which people may feel is not enough, which may cause problems. Or it might be that there are problems identified within adult social care services that have actually been caused at another part of the system. So our ability to regulate a whole system, so we absolutely will retain the ability to regulate individual locations, individual providers. That is not going to change, but we are going to increase what we are able to regulate, to be able to look at how a system works together in a particular geographical area, and how different pressures in different parts of the system can impact on care. So at this point, I haven't really got a lot of detail about how we're going to do that, because this is still very new for us as well. A lot of this is still being worked through, but this is the ambition for the future. So obviously, if we're able to look at a whole system, how the system works together, we're able to identify where inequalities are, and hopefully work to reduce those. And I think that's particularly relevant in terms of accessing health services. just, I think we're all aware, obviously, because of the pandemic, the way that we've been able to access health services has changed. So, for example, now to access GP services, there's a lot more access done through the use of technology, which might actually be a barrier to many people in the population, potentially elderly people, people with a learning disability, or people who just don't have access to technology or who struggle to use it independently. So they're the kinds of barriers to access in healthcare that we can kind of think about in this system regulation piece. Okay, so if I could have the next slide, please. So the new strategy is based on there's four strategic themes. So these are focused on people and communities, smarter regulation, safety through learning, and accelerating improvement. And then sort of linked to all of these four themes is the idea about assessing local systems and tackling inequalities in healthcare. So if I could have the next slide, please. And in fact, if we can just skip on to the slide that's the second slide that says people and communities. Okay. So this is the first of the themes in the strategy, and so as I've said, we really want to focus our attention on how we collect information, or how we engage with people who use services to really get feedback on care. And I think this was something that was raised with me actually as a concern in terms of when CQC talks to people who use services, they may express concerns about various aspects of their care, which are actually outside of the control of the service provider. So, I mean, I think we do recognise that that it is not everything that is within the control of the individual service provider. And I think this is where CQC's ability to regulate the whole system actually will be really of benefit, because when people within an adult social care service raise a concern about something that is actually driven by another part of the system, we will have hopefully a better way to respond to that. But we certainly want to make it easier for people to talk to us. We want to become more accessible. We want to make sure that we are collecting people's experiences and really helping using that information that people tell us to help us drive our focus in our regulatory activity. If I could have I think it's 2 slides on that says smarter regulation. So what this means, and this is really, I suppose, the aspect of our strategy that's most related to our new monitoring approach. So as I said, and as you're all very well aware, we always, went out to inspect services based on a kind of a set schedule, and we always did respond to risk in between that. So that has not, that's not totally new, but we are wanting and we are moving towards being able to collect much more information about services so that we can direct our inspection activity where the risks lie in the services. Because obviously, a good service might have been rated good. We potentially wouldn't go back to that service for another 3 years. And of course, a lot can happen in that time, which means that the service is no longer good. And, there can be various changes that may have happened, risks that will have developed. So we want to be able to have much more accurate, real-time information about where the risks are within the system so that we can direct our inspection activity and our regulatory activity where the risks are the highest. This is really underpinning our new approach to how we're going to regulate. So I will speak a bit more about this when I talk about our new monitoring approach. So if I could have the next slide, please. So yeah, as I said before, you know, there has been a lot of concern raised about whether we're still going to be doing site visits, and yes, we absolutely are. That isn't going to change, and that is a really, really vital part of our inspection methodology. But we're also going to be able to use other methods, other regulatory methods, so that on-site inspection isn't the only way that we'll be able to get a picture of quality within services. And this is where using data that we collect is going to be really important, because obviously we're monitoring services constantly, whether or not we're going out to visit them, because we get a huge amount of information that comes into CQC on a daily basis through people reporting, you know, whistleblowing, safeguarding, share your experience. You know, we get contacts from local authorities, from members of the public, from service providers, the notifications that you submit to us. All of these things help to inform our regulatory monitoring. Okay, so if I could have the next slide, please. So the next theme of the strategy is about safety through learning. So we know that where services have got a really strong learning culture, that actually those services are safer, because people aren't afraid to report mistakes, thinking that they will be penalised because they've made mistakes, but actually because the service learns from those mistakes. So this is going to be another key aim, that we are going to be really looking at cultures within services and promoting learning cultures to really promote safety. If I could have the next slide, please. And then if we can go on to the next one. Okay, and then the final of the 4 strategic aims is about accelerating improvement. So we really want to be able to work with health and care services and local systems to support improvement and to support improvements in quality of care. So if I could move on to not the next slide, but the one after that. So this is a bit of a busy slide, but that just summarises our 4 main themes that we've got in the strategy, and then the outcomes that we will be measuring our success by. So I presume we'll be sharing the slides afterwards, so you can kind of have a look at that. So if I could move on to the next one. So this is year 1 of our strategy, and our priorities for this year is that we're going to be, you know, working in partnership. We'll be developing our ability to monitor risk, and we'll be testing our new assessment framework, which is our transitional monitoring approach, which I'm going to speak about in a moment. And then we'll be using the insight that we gain from this work to drive improvements using our independent voice, so supported by the development of a new provider portal, as well as a mobile-friendly website, to hopefully make it a bit easier and simpler for people to interact with us. We're also going to be carrying out some further research and engagement work to develop our collaborative work on safety and improvement. And then we'll also be exploring our approach to how we're going to assess local systems, and how local systems understand the needs of people in their area, particularly thinking about people who might experience most barriers to accessing care, and for people who've traditionally had the poorest outcomes. So these are our strategic priorities for the first year of our strategy. So the first one of those is developing how we monitor risk and testing this new assessment framework. So that kind of leads me into talking about CQC's new monitoring approach. So I'm sure that you've familiar with this to an extent already, but obviously it is still very, very new. So if I could move on to the slide that says 2021 on it, yeah. Sorry, the previous, I think the previous one. Thank you. So back in 2020, obviously the pandemic hit and took everybody by surprise, and we paused all of our routine inspections at that time, and we knew we needed to develop a way of keeping in touch with providers. So of course that's where the emergency support framework came from, and we were having those calls with providers which were quite narrow in their focus. So this new monitoring approach is really building on from that, and so this has been rolled out from June of this year, and the aim is really to enable us to, as I said, to be more targeted in our regulatory activity. It also gives us the opportunity to bring all the information that we hold about a service together in one place, which means that there is not the risk that we don't see information because it's held on different systems, etc. And then we want to develop elements of this approach, going forward for how we want to work in the future. So I think it's important to say that this is a transitional approach at the moment. So it's an iterative process. We're sort of trying and testing it. So the way that this works, if I could have the next slide, please, and forgive me if you sort of are familiar with this already, but I think it's worth just going over it. So basically, all of the data that we hold about all of our services, which includes the rating, the previous rating of the service, the previous inspection report, any information about enforcement activity that might have taken place in a service, as well as all the kind of other data, as I mentioned before, such as information about whistleblowing or safeguarding complaints and all that kind of thing, as well as positive information, compliments, people who share their positive feedback about services. So all of that information is reviewed on a monthly basis. Now, when I say that, what I mean by that is that it's reviewed within this data model on a monthly basis, but obviously inspectors are reviewing information about services all the time. But as a result of this monthly review, a service will be allocated a banding and a prioritisation score, which will be either low, medium or high in terms of risk. So for those services that are low risk, we will publish a statement. So there is a statement that goes onto our website, and you can get a banner for your website, which basically says, we've reviewed all the information that we hold about this service, and at this time, there is nothing to indicate that we need to conduct any further regulatory activity. And obviously that is valid for a month, because at that point the information is reviewed. But if nothing changes, then that will stay in place. If a service is assessed to be high risk because the information that we hold about that service is suggesting that there are current ongoing risks within the service, then we will come out to inspect that service. So just in the same way as we always did, we'll come and do an on-site inspection. We will provide a rating for the service, and then we will publish an inspection report. So that hasn't changed. But for services that are assessed as a medium risk or medium priority, that's when we will conduct a further monitoring activity, which is called the direct monitoring activity. So this is where the new approach comes in. And basically what this means is that inspectors will contact services to arrange a call with the registered manager or the registered provider. And prior to that call, they may request various pieces of evidence. some inspectors may request evidence following the call. Every one of these monitoring activities is tailored to the individual needs of the service. So, you know, there isn't one size fits all. So sometimes you might get a request for information prior to the call, sometimes it might be afterwards. But the purpose of the call is to really review particular bits of information that might be flagging as areas of concern. So the inspector will focus that call around a particular CLOEs, and we will look at various CLOEs in each of the domains of safe, effective, caring, well-led and responsive. But depending on what the information that of concern is, the questions might be slightly different. So, you know, if you've had a call that the inspector was focusing on particular things, it might be that you speak to another provider and they've had quite a different experience. And that's really because each of these calls is tailored to the information that we need, or the assurances that we need from the service. Now, as part of this, we will also be seeking to get service user voice. And it might be that we hold service user voice about the service already that's very recent, that we can feed into this process. Or it might be that we seek new service user voice, and it might be that we ask service providers to provide that. So, for example, if you've done a recent survey and you've got results of that you can share with us, then it might be that we simply ask you to provide that information for us. And then as a result of that, that monitoring activity, we will decide whether or not further action is required. So if we've got assurance that actually there are no current risks in the service, then we will just continue our ongoing monitoring of the service. But if, as a result of that activity, we identify particular risks or things that we think we need to look at on-site by an on-site inspection, then we will come out and visit the service for an inspection. Now, as part of this monitoring call, you as service providers will receive a summary of the call, but there is nothing published. So it's not that you get an inspection report in the way that you would with an on-site visit. Sorry, excuse me. So that is kind of the overview of this new approach. And if I could move on to the next one. And okay, so this is just what I said before about the public statement that's published on our website, and yeah, okay, so that's what I've said before. So if I could just move on to the next one, please. So yeah, we rolled out the monitoring approach in June with a few general practices, and then this was rolled out to adult social care in July. So we have been using it just for a very, very short time now. So some people on the call may have already had a call from us as part of the direct monitoring approach, but you know, we are still kind of getting to grips with this approach ourselves, and we are now also rolling this out to NHS trusts. So I believe that process actually has started already. And as I said, this is an interim approach as we move towards implementing our new regulatory model next year. So we are testing this, and we welcome feedback on the way that it works. So I think that's a kind of very whistle-stop tour of it, but I wonder if it might be worth just pausing here to see if there's any questions about any of this before I move on to talk about vaccinations.
Thanks very much for that, Emma. Peter, sorry, there were one or two questions in the chat box. I know that we're obviously time constraints as well. So I'll just share one or two questions that were raised very quickly. And one of them was from Ola Yinka, who said, for those of us that we've submitted data that was used in placement inspection, but that did not reflect the rating, what's the next phase regarding rating?
Yeah, so that's a good question. So we do realise that there will be services who have improved since we last inspected them. So it may be that if we do a monitoring call with those services and we see evidence that suggests improvement has been made, we may be able to come out to physically inspect those services to be able to re-rate and publish a report. Now, I'm not saying that we can do that in all cases. That will definitely be on a case-by-case basis, but there is certainly the opportunity or the potential for services that have demonstrated improvements, and they can demonstrate that at the time of the monitoring activity, that we may then come out to re-rate. And I think, you know, particularly if there are pressures within the system that, for example, a service having an RI rating is causing problems because possibly, you know, people are not going to commission places there, then we will certainly look at those on case by case to see whether we can re-rate. But I think that there will be more information probably will come out about that as we sort of get used to using this approach and we think about how is the best way for us to do that, because we are aware that, you know, there will be services that have improved that would like an inspection and potentially are having to wait a bit longer than they previously would have done.
Okay, and Emma, do you believe then that having, for example, high risk attached to your rating or as part of your inspection or review could hopefully also balance up the fact of their actual rating as well?
Sorry, could you say that again, Dudley? I just cut out a little bit.
So the fact of from your risk assessment that you've done, that you'll be doing with their rates high, medium or low, would you feel that would also play a place in when they actually are placements or no as well? Because I think we all have relied on the Chloes, we all relied on ratings, and that's what a lot of local authorities rated services by. And you did mention placements for a lot of services are on your ratings, and if your ratings aren't to a certain standard or level, because a lot of SMEs are in this sector, 50% plus, are going to suffer as a result of that. And I think they're trying to improve themselves, and what you're telling them is that yes, you are going to be rated, but it may not change the rating almost immediately or directly. It just shows which seems to me like you're having a risk assessment, and it shows that your risk is good as opposed to bad, but it doesn't change the fact of the quality of your service. Is I think what a lot of service providers want to sort of see.
Yeah, no, and I do take that point. I suppose, so what I would say is that if services can demonstrate improvement through the monitoring activity, so for example, because the services that fall into the low prioritisation are probably services that are rated good or outstanding already. Now, of course, there is a debate ongoing about, well, what happens to good services who then want to go for an outstanding rating? Now, unfortunately, I haven't got the answer to that today, and you know that is something that we are aware is an issue, and we will be looking at how we address that as we move forward. But for the services that come out into the I mean, obviously the high risk services, you're going to get an inspection. So if you've improved, you're going to get a re-rating. So that's not a problem. It's the services that are in this sort of medium risk category. So as I said, you know, when we do our monitoring activity with those services, we will look at those the evidence for improvement. So because this is obviously, it's more than that ESF call, which was just a conversation. So as part of this activity, we are requesting evidence to be sent to us for us to review that. So if we have got a service that we can see that there is clear evidence to demonstrate improvement in that service where they would benefit from re-rating, we can look at whether we can make the case to then come out and inspect that service. But that will be on a case-by-case basis, and that will, you know, depend on capacity and lots of different things. So I can't promise that all of those services will definitely get an inspection, but what I would say is that if you can demonstrate improvements and provide evidence of that improvement, that we can certainly consider whether we can make the case to then come out and do an on-site inspection, and particularly where there are pressures within the system where that would be a benefit to the system, we will certainly look at that. So yeah, so it's about providing that evidence of improvement that then we can look at whether we can come out and inspect as a result.
There's another point I would raise that, but I think because of time constraints, the next question, which is related to that, is more for new providers who haven't had an inspection yet and are waiting to have a rating, and they haven't got that, and there's lots of concerns of they can't get work or placements because they haven't had a rating yet. So what would you say to
So in terms of new services, once those services have been registered, I think it's for 18 months, they will automatically get an inspection. But if you're a newly registered service and you haven't been registered for that long, and actually not having a rating is impacting on your ability to get any business, then what I would say is to contact us, because we will consider those cases on a case-by-case basis. So if that is impacting your ability to get business, then please contact CQC, and we will look at that for you.
Thank you. Sorry, I think we've got a couple of questions that we will go on, because I know you want to go into the vaccine, which I know is another area which I think people want to listen to. I think a quick question is about inspections. Are they still happening every 30 months? Was what someone had asked in the chat as well.
Okay, so no, we are not inspecting based on any of the previous time scales. So it's purely based on these prioritization scores. But also, I should also say that outside of that, if you know, we become aware of risks in a service, for example, that's been assessed as a band 1, like, we will still go out and inspect it. So where risk comes into CQC, we will always consider whether we need to actually physically go and inspect the services, and in many cases we will. So it is, our inspection activity has been directed by the data that we hold about risk, rather than any kind of set timescales as it was previously.
There was another question, and I think we've got two before we go. I think, Peter, I'm not sure if you want anyone to ask, or maybe we'll do it at the end of the vaccine discussion you've had, Emma. It was about previously before, for those providers who had their PIR, it was determined that an inspection on-site visit would come soon afterwards. The PIR, I think you've probably already answered this, but it's what is going to determine the type of visit or telephone conversation or consultation that's going to happen. Will you be told what's going to come up, basically, after the PIR?
So we did actually make changes to the PIR prior to implementing this approach, because you're right, you used to get the PIR and then you'd know that shortly afterwards you're going to be inspected. So it kind of gave providers a clue that if you get that PIR, then prepare for an inspection. So we wanted to avoid that, actually. So we were then issuing the PIR 12 months after the date of registration, and then every 12 months. So basically now you'd receive your PIR annually, you know, on the kind of anniversary of when you registered, so that people wouldn't necessarily know when they were going to be inspected based on when the PIR arrived. So that is the approach for now, anyway, going forward. Sorry, was there a second part to your question?
I think it was more to do with the PIR. Does it determine, how would you know what type of inspection is going to take place? And I think you've sort of answered it, whether you were going to do a telephone consultation, whether you're going to do a site visit, what would happen as a result of that. Yeah,
okay.
And then the other part will be, does the PIR affect or impact your banding? I guess the way you answer the question.
Well, I mean, I suppose if the PIR identifies particular risks within the service, then that might, you know, if you or if you can highlight. I was like, yeah, that is a good question. I mean, I suppose we're using all of our data to influence this risk model. So I suppose the PIR, I'm assuming, okay, I need to take that one away because I don't want to give the wrong answer, and I'm not 100% sure about whether that PIR information does go into the model. I'm assuming that it does, but I'm not sure. So I will find that out and I'll come back to you if that's okay.
That would be great, Emma, because I have been on conversations where there's been conflicting sort of information that the PIR doesn't affect your banding or rating. It's more the information that they're asking that you would but then again, as you said, it'll be good to get a definitive feedback from you, and then we'll
yeah, no, I'll come back to you on that one because that's a good question.
Peter, do you have anything to ask before we ask Emma to continue with the vaccination side of her discussion?
No, I don't, Dudley. Happy to move on.
Right.
Okay, thank you. So, right, if I can have the next slide, please. So, obviously, this is a very, very hot topic on everybody's mind at the moment, and also one that is quite controversial. I think it's just worth saying at the outset, because I think sometimes that, you know, possibly there is the perception that CQC make the regulations, but actually we don't. So the government decides on the legislation that we then have to enforce as the regulator. So I think, you know, there is obviously a lot of conflicting opinions about whether vaccination as a condition of deployment is the right approach for the care sector. And I know that those debates are going to be continuing, so I can't necessarily comment on that. But what I can talk about is how we are being asked to implement this regulation and how you as service providers are going to be asked to evidence it. I will say, though, that we are very well aware of the concerns about the impact of this on the sector. And, you know, if you have got specific concerns about your service, we would encourage you to raise that with the local authority or raise it with the Department of Health and Social Care regional assurance leads. And of course, we will, as CQC, we will continue to monitor the impact on the sector, and that is also part of our role to report on those things to the Department of Health and Social Care. But in terms of what we are being required to do as of November, we will be on inspection. We will be looking to see how you're implementing this regulation. So registered persons will not be required to show CQC.
It's a CQC webinar.
I think somebody's...
It's CQC webinar. It's for my own information.
Sorry to butt in. Can I ask people to mute their microphones if they're not actually asking questions, please?
Thanks, Peter. Yeah, so registered persons will not be required to show CQC a record of the evidence itself, okay? But what we'll be looking for is reassurance that you've got systems and processes in place to ensure that individuals who enter the premises are fully vaccinated if they need to be. So as a registered person, you might choose to make a record of that evidence that you've seen, for example, for your own internal staff, but you don't have to do that. But if you are going to do that and you are going to record information about people's vaccines, then all personal data that you collect has got to be handled in accordance with UK GDPR. And that would include providing people with privacy information at the time that you're collecting that data. So the Information Commissioner's Office has actually produced some guidance on this. So if you go onto their website, there will be a little bit more information about how you can meet your GDPR requirements if you choose to make a record of that information. But basically what we're wanting to see, we don't want to see a list of names and who had what vaccines and when. We just want to see how you can provide assurance that you've got a robust system to check that. So if I can have the next slide, please. So yeah, so just to reiterate, so the Department of Health and Social Care guidance makes it clear that you don't need to keep a copy of the evidence that you've seen, but you need to just record that you've seen it. And as I said, for your own staff, you may decide to keep a more detailed record, but for visiting professionals, you simply need to tick a column in the visitor log to say that you've seen the evidence. So that could be, you know, on the NHS app or the card or whatever it is. You just need to tick to say that you've seen it. So if I can have the next one, please. And at the moment, the regulations are only relating to 2 doses of vaccine. So we don't know at this point if and when we're going to be required to have booster doses. But if we are required to have booster vaccines, then that will also fall into this. So we don't know at this point if or when that's going to happen. And unvaccinated care workers can remain in post until the 10th of November, but they won't be able to enter the care home from the 11th of November. And then people who are on maternity leave at the moment or on long-term sick leave or sabbatical, they don't have to be vaccinated by November the 11th, but they must have had both doses of their vaccine by the time that they do return to work. So if I could have the next slide, please. And I think this was something that was discussed a bit earlier. So at the moment, we still haven't had the guidance about exemptions, and we're hoping very much that that's going to be available soon. But obviously, for a small number of people, vaccination won't be appropriate because of clinical reasons. And although we haven't yet seen the list of what those clinical exemptions are, it's thought that there actually aren't that many. So it might be that you have staff who think that they would be exempt, but potentially won't be. So it will be, yeah, really helpful when we get that guidance so that you'll be able to check that with people. And again, you don't have to record why people are exempt, but you just have to record that they are exempt and have a process for recording that. And then if I could just have the next one, please. So there is a bit of an issue related to people who've been vaccinated outside of the UK. So even if they have had a vaccination with an MHRA approved vaccine, at the moment that isn't good enough, apparently. So Department of Health and Social Care is working on a solution to this and is going to be producing some guidance. But again, we haven't got that yet, so hopefully that will become available soon. And then if I could just have the next slide. So there's some links there. So the Care Providers Association did a webinar recently with CQC and NHS England, and they've produced some frequently asked questions, which my slides are taken from. So that's the first link there. You might want to access that just to go, and there's various other questions about this issue. There are also going to be 2 other webinars around vaccination as a condition of deployment. The first one will be on the 16th of September, and that will be specifically around workforce and HR issues. So that's aimed at care home managers and HR leads. And then there's another webinar that's going to be on the 17th of September. And this one is going to be focusing on visitors to care homes and essential caregivers. And I'm sure following those webinars, they will produce more FAQs because obviously, again, this is so new that there's lots and lots of questions. And unfortunately, we haven't got all the answers yet until we get the guidance from DHSC. But I would say just keep checking back to the CPA website because they will post any updates on there. So that was really it from me on vaccinations. If anyone has got any questions, I'm not sure I'll be able to answer them, but I will try my best.
Okay, thank you very much for that, Emma. There were a few questions which you probably may be able to answer. There were other questions about about a staff member having had their first vaccination is refusing to have her second vaccination. And of course, the questions around how they register her and is she allowed to work in the care home or not. I think from a point of view of answering that question, yes, you probably can answer it. I guess from a regulatory point of view and someone as an enforcement, what would you do, I guess would be the question if you come across that.
Yeah, so that person, if they would be able to work in the care home up until the 10th of November, but after that they would not be able to. So I suppose, you know, it's a really, really difficult one, but I guess it's about having those conversations with people. You know, if somebody's had their first vaccine, they were obviously open to that originally, but possibly might have had a bad experience with the vaccine that's putting them off having the second one. So if there are sources of support that you can refer people to get advice. I mean, if it was to do with a medical reason that they might not be able to have a second vaccine, because there are, of course, a small number of people who may not be able to have a second vaccine for a genuine medical reason. So again, I think that would be about getting the person to go and speak to their GP, if that is the case, to talk about whether they would be medically exempt. But if it's just a case that they don't want to have another vaccine and that's their personal choice, then following the, from the 11th of November, they would not be allowed to work in the care home.
Another question that came up, and I think you probably do have the answer for this, but it's about locations and the types of providers who this will relate to. Someone in the chat mentioned that they work with extra care and whether the enforcement will apply to them, if they'll be covered in that.
Okay, so at the moment, no, this is just applying to care homes. Now, obviously this debate is ongoing as to whether this will also be rolled out to other health and social care staff within other settings as well. So at this point, we don't know that. But it may well be the case that as time goes on, this requirement becomes applicable to all health and social care staff. But at this point in time, it is just in relation to care homes.
And someone asked a question before that said to me, if people aren't vaccinated and you do find them that they haven't vaccinated all their staff, what will happen to the service as a result, or the provider, or the individuals?
So if the provider had not taken all reasonable steps to ensure that people had been vaccinated as appropriate, then that would be a breach of the regulations. So we would treat that in the same way that we would treat any other breach of regulation. So we would assess how serious the breach was, what the impact on people of the breach was, and then we would consider what regulatory action was appropriate. So obviously every situation we would consider it on an individual basis to look at what the failings were, why they occurred, and what the impact on people who use the service is or might be as a result of that breach of regulation. And then we would decide on the level of regulatory action to take in response to that.
And you did touch upon what would be what you would use as evidence for a vaccine. I'm not sure if there's any sort of guidelines you have for the providers out there, or what would be a suitable form of evidence that you would be looking for, apart from just obviously the provider having it written down. What other sort of would you suggest where they go to demonstrate?
Do you mean for the evidence that the provider gets from the staff, or the evidence that we would be looking at?
The providers they get from the staff that they would be showing to yourself.
Right. Okay. So, as a service provider, you would need to see a form of evidence from your staff, which would either be through the NHS app, or it would be a certificate of vaccination, a letter of vaccination, or the vaccination card. And then you would need to decide how you're going to record that. So it might be that you check that information as part of your recruitment procedures, and that you record it in your recruitment files, and then you have some kind of matrix of how you have checked it, which might not necessarily include the specifics of who's had what vaccine, but it might just be a staff list against the date that you checked it, who saw it, what kind of evidence you reviewed. So there might be different options. We're not going to be prescriptive about what you should show us, but you just have to show us some kind of system that you've got in place for how you're checking and how you're recording it. So you might want to record that in your individual personnel files, but then you'd probably want to have some kind of way of looking at an overall picture of when staff were checked and who is responsible within your organisation for doing that. Is it going to be the registered manager? Is it going to be HR? And obviously this will also depend on the size of your service. So it might be good to have a policy that you put in place of with a procedure for like who is responsible, how they will do it, when they will do it, how they will record it, so that we can look at your policy, we can see what's meant to happen, and then you can show us how you're recording that. You might want to do some audits at various different time periods to check compliance with this, because if you get new staff on board, how do you make sure that people haven't just slipped through the net because people forgot to check, all these kind of things. So it's really the same as how you would evidence your training records, for example, or your recruitment checks, any of those things. It would be similar. So that's the kind of things that we would be looking at.
Can I just add a couple of points here, if I can get a word in, Dudley? I see Amanda has actually just raised a point in the chat with regard to the vaccination card. We have been told that, for example, vaccination cards are not legitimate evidence of being vaccinated. They won't accept it, for example, going into a football match or into a theatre or any sort of crowd venue. One has to produce either the app or a copy of a letter. And a number of people seem to be using the letter or a copy of the letter as, you can check it against the identification of the individual as well. Certainly we've been asked to sight of the letter and photo ID to check, to cross-check. Just going back in the chat, there was a point raised about supported living. There seems to be some confusion with perhaps with some local authorities about what supported living actually is. If it's registered with CQC at all, then it will be counted as a DCA. But much supported living, of course, isn't CQC registered at all. That's quite correct. But it seems that some local authorities are making a requirement that all the staff going in, as they're working in someone's home, which would in that sense apply across all DCAs, that those staff must be vaccinated, which as far as I can find out is not correct.
No, it's not. It isn't.
Okay, thanks.
No, it's very clear. It is just CQC registered care homes at this point in time. Yeah.
Yeah. exactly. That's actually telling.
Yeah, no, you're right. I'm just actually checking what you were saying about the evidence that people can use. I'm just having a look on the DHSC guidance. So actually, yes, you are right. So what it's saying is the NHS app, the NHS website, and the NHS COVID pass letter. So yeah, you see, it says that, yeah, an individual's NHS appointment card cannot be used as proof of vaccination status. Yeah.
Yeah. I mean, if
it doesn't say anything about photo ID, but I mean, I guess you would want to verify the ID of the staff member anyway. So, yeah, I'll just post a link to that guidance so people can.
Thank you. I mean, I think Emma and Peter, and lots of people on this virtual call are concerned, and they have lots of staff, and obviously verification. You did touch upon those who may have been vaccinated abroad as well, which we're still waiting from, as well the actual vaccines that can be acceptable here, and I think also check on the website, the government website as well, of which vaccines which are regulated to be used as well. There was a concern about the Janssen, whether that can be deemed as one of the ones on the list, and I think there is evidence that it is as well. So please use, or whoever you are advising, to get all staff to make sure they are getting official vaccines done. And I think there are now, I know we've got till the 16th, the first vaccine to happen. There are lots of places and venues that will give them the vaccine, and there's taxis as well, which will be deployed to take staff to their places to where they can get the vaccine done as well. So please do check. There's lots of information about.
Right. Can I just sort of ask in general, as we, you've got the opportunity with Emma being with us today, are there any other questions that you want to ask CQC, or even, get answered later?
You can raise your hand if you do want to ask a question as well, directly to Emma. I think there's someone, is it Natalie, is it?
I just wanted to ask Emma regarding some of the professionals who does not want to show evidence of vaccination.
Mm-hmm.
Yeah, because we've had difficulty. I just addressed the topic with some of the community nurses recently, and the answer I got was really like, she was very annoyed that I had the audacity to even ask her that. So, yeah.
Well, unfortunately, whether they like it or not, if they want to come into your care home, they will have to show you evidence that they've been vaccinated. And if they don't, if they're not willing to show you that, then you have got the right to refuse them entry. And I would escalate that to their management. I think that this has been raised with, some, because I think we have heard this issue before, possibly about certain district nursing teams, etc. But this will come into force as of the 11th of November. So if they want to come in, they have to show you their vaccine. And yeah, if they don't, take it up with their manager, I would say.
I think that's a very good point that Natalie has in a way been brave enough to raise, because I don't know whether Dudley's had it put to him, but I've certainly had it put to me a number of occasions that nurses and GPs have turned up and refused to show evidence. I'm in the NHS, I know what I'm doing, I'm a professional, I'm a doctor, let me in. And to a degree, it's also applying to paramedics with with ambulances, because they don't have to have the jab. And it's a real situation if someone turns up with the blues and twos on, and you've got a very ill person. Who's going to be liable if
So there is that exemption in the guidance that to provide emergency assistance, somebody that you would be able to do that. But yeah, so that's quite a difficult one when it comes to ambulance crews, because if they aren't willing to show you evidence of vaccination, but it is actually an emergency, you may decide that in that moment you do your risk assessment and that the risk to the person of not getting that emergency help is greater. But I think if you do encounter those kinds of problems, that we would really like to hear about those, because we can flag that with different parts of the system. If you're coming up against ambulance crews who don't want to show their vaccination status, etc., then that is not what we hope is going to be happening. So if you are encountering things like that, then please do let us know, or let your local inspectors know about that. And I think up until now, professionals might have, I don't want to say got away with it, but people might have said like, oh, I don't need to show you my vaccine status. But as of the 11th of November, it will be the law. So they are not in any way exempt from the law, unless they are genuinely exempt from having a vaccine. But in that case, they would need to provide you with some evidence of that as well. And I think people are well aware of this. They're well aware, it's been all over the news. So professionals have got to be aware of this as well. And they have to start cooperating, really. So if they don't, we would like to hear about that. Please get in touch with us.
I think that's a great point. I think in the chat room, Amanda has mentioned, if you are having issues, CCG or local authority, and make them aware. The other thing I would say that people should be aware of is also local contractors, because we're talking about health professionals, but we're also thinking about, it could be your lift person comes to the lift, it could be someone else who's regularly in your building that people forget about. Those are the individuals you have to speak to in regards to, are they double jabbed? And one person raised a concern that maybe put something out to the local business quorums to make them be aware that care homes are needing to be double jabbed. People are going into the care homes, they should be aware, because we all have regular suppliers and contractors who come in and out of our business, and they are also part and parcel covered in this parts of this regulation. I think it's important that we should know that. So that's my advice, so people should be aware.
Yeah, and also this applies to CQC inspectors as well. So if inspectors turn up to do an inspection, we also have to show proof of our vaccination status. So yeah, it applies across the board.
I don't want to stop people asking questions, but we really need to move on, because there's some quite important stuff from Skills for Care. If anyone's got any points, there's a couple of points in the chat that I'm sure we can get an answer, and we can publish that afterwards. If there's anything pressing, Emma, if you'd like to fire away with that, and then perhaps if we could wrap up with the CQC side of this. Sorry to sort of rush that through.
Yeah, so if there are other questions, you can just email me afterwards, and I'll try and find an answer and provide an answer and get back to people. So yeah, thank you very much for having me today. I do have to rush off now, I'm afraid, but yeah, hopefully I've been able to answer some things, but I'm sure lots more.
Thank you very much, Emma. Thanks from all of us, and we'll be in touch.
Thank you, Emma.
Okay.
Thank you.
Okay, Emma's gone. Okay, without further ado, I think we've still got Selena with us, and we've also got Laura with us. I've got a presentation from Skills for Care. If I put that up, is that okay? And if I also just eject the cat again.
We love the cat, please.
Right, just let me find the...
Okay, while Peter's doing that, good morning, everyone, and it's fantastic to see so many of you here. We had sort of lower numbers throughout the summer. I guess everybody was trying to grab their holidays when they could. But it's really fantastic to see so many of you here, and apologies if I flooded your inbox again yesterday with reminders, but it's so important that we get together and we share in network. So thanks very much for coming, and hi to Laura, who's also here. So I'm going to make a start. I'm Selina, I'm from Skills for Care, and I'm the locality manager for North West London. And then Laura's going to kindly finish off for me. Following on from Emma's presentation, what I have made a few notes of things I would like to point out. Firstly, we do work very, very closely with Skills for Care, CQC as an organisation, and we are all tapped into our local CQC inspectors. So if you do have questions and challenges and issues, please remember that we also have those links into CQC, and we can pose any questions and challenges for you. If you've got any general challenges or issues around vaccination and around the new inspection framework, we do also have direct links into the Department of Health and Social Care, and we do have regular meetings with our locality rep from the DH. So we do give them intelligence from yourselves as providers as to what's going on out there and what the challenges are. So it's really, really important that you feed into us anything that's going on. And on the very last slide of our presentation is mine and Laura's contact details. So please, please keep in touch with us, because things won't change unless we feed it back. And obviously we're about to go through a period of change with the new bill and the announcement from Boris Johnson. So, you know, it is really important that we hear from you, not just through these networks, but also by direct contact into us as locality managers. That's what we're here for, as well as the LCaS forum. So I just wanted to remind you of that. The other thing I wanted to remind you of is that relating to CQC, we do have a whole bunch of resources on our website about improving your ratings, workshops that we run, advice and guidance and resources all around inspections, ratings, and so on. So please, please do try and have a look at those if you can. And even if you've had really good outcomes and really good ratings and you want to maintain those, we have resources around that as well. And
if I could just quickly interrupt a quick point, Selina. I mean, we speak to a lot of care providers. Available to you as care providers, there's a huge amount of resource on the Skills for Care website, on the NICE website, and frequently people ask us the same questions that they could find the answer to, and the paperwork and templates, etc. And it's there, it's free, and it's up to date, and it's really useful information.
Yeah, thank you, Peter. And if you don't have time, because I know what it's like, I mean, sometimes I don't even know what's on our website because there's so much there, but just drop us a line and ask us a question, and we'll send you a direct link to the resources if you don't have time to go trawling through or you're having difficulty finding stuff. We're very happy to do that, and that's what we're here for. And we do provide support and consultation as well. If you are having difficulties with your ratings, your inspections, and you have been asked for improvements, Skills for Care do provide that service as well. I did recently send out a Keeping Well poster. I'm hoping you all got it. I blasted everybody's mailboxes with it. Please do remember that there are those services available to you, and to have put the posters up for your staff to have a look at. What else was I going to say? Yeah, that was my main thing. So probably going to have to pass on to Laura now. Sorry, Laura, I haven't even really started the slides, but you can probably whip through some of it and then people can read afterwards. The only other thing I wanted to remind you of is on the 22nd of September, we have our Deputy Manager Network, which is for the whole of London and the South East. So far, we've got 55 deputy managers signed up to that. So can you remind your deputies that we have a network specifically for them, and that's happening on the 22nd of September, and they can book it via our website. And I'm going to shut up now and hand over to Laura, if that's okay, because I have to flip off to another meeting. So great to see you all, and do remember to keep in touch. Thanks, Selena. If you go on to the next slide, Peter, I can go through these fairly quickly. Is it possible to make the slide a bit bigger? If that is possible. Hopefully people can see that. So yeah, vaccinations. We've actually created a one-stop shop on our website where you can go to for kind of advice, information about the new requirements. So on there, we've got a frequently asked questions document that's being updated fairly regularly. We've got some case studies of other care employers and how they're actually approaching all of this. And quite crucially, we've got some links to resources that can support you with recruitment, with retention, with workforce planning, yeah, which would hopefully be helpful to you. And the link's just on the bottom of the slide there. Go to the next one, please, Peter. And something we're running is we know that managers are understandably very concerned about this regulation coming in. It's just running some regular dialing sessions that people can come along to and find out a little bit more, talk to other managers and find out what they're doing, just talk through their concerns and hear from Skills for Care about any resources or guidance that may be helpful. So we've got the second session on the 24th of September at 11 o'clock. And that's open to managers of any types of service, as we know that the requirement may be extended to domiciliary care, supported living potentially. And at this session, we're going to have a South London employer actually talking about what they're doing and how they're changing their policies and procedures, how they're engaging staff, and what they're doing in terms of changes to their recruitment policies. So that should hopefully be really helpful. And if you'd like to come along, just email me. The address is on the slide there, and I'll send you the booking link. That'll be about an hour, hour and a half, very informal, just a chance to kind of raise concerns and hopefully get some help from other managers. Okay, Peter. Yeah, recruitment. Sorry, I wasn't here for the start of the session, so I'm not sure if it's already been discussed, but we just do know how it's more challenging than ever at the moment to recruit staff. And we've really focused on that in the last 2 months with all of our promotional materials. And there's lots of resources, support on our website, if you want to go on and have a look. Okay, Peter. So just some recruitment tips, so these would be helpful. So talking to your local job centre plus, we know that furlough is going to be ending in England at the end of September. So there could potentially be a pool of people looking for work around then. So do get in touch with your job centre plus and send them a kind of detailed list of your vacancies. And Selena and I can link you into your local job centre plus officers. Some local authorities as well are very mindful of all the challenges you're facing at the moment and are running recruitment programmes themselves. So do talk to your contacts there. Local colleges and universities as well. People will have finished their courses in kind of July, August, maybe looking for work. So speak to Selena and myself, we can put you in touch with local FE and local HEI institutions. Now the Prince's Trust, they're doing quite a lot of work at the moment to support young people into the sector. So they're running employment programmes so people get more information about working in care, kind of equipped to some of the skills they may need to work in the sector. And they're actually looking for employers who can offer these young people vacancies. So once you get these slides, just click on the hyperlink, and you'll be taken to more information about that, including details of the project manager who you can have a chat with to find out more. If you can move on to the next one, please, Peter. So if you're in a care home, could you talk to your local dom care service contacts? We do know that lots of staff at the moment, or potential staff, aren't suitable for dom care work as they're not drivers, but they're still keen to work in the sector. We don't want to lose these people. So could you offer them a role within your service instead? There's also local employment services you could link into. Just an example is Croydon Works. I do get in touch and I can send you the link to them. And they offer a free recruitment service to local employers. There's free jobs boards as well. So the Department for Work and Pensions Find a Job site, which you can link to via the hyperlink there. And some of you may be aware of Nextdoor, and that's an app which links people in neighbourhoods. And I see in my local one, lots of organisations use it to advertise for staff, and it is free of charge. You can have 2 free business posts a month, so that could be worth looking into. I do often see care companies advertising for staff. I don't know how successful it is, but it's free, so it could be worth a go. And speaking to local voluntary sector organisations as well, just in case you know of any volunteers who want to move into paid care work. And there's lots of free sessions at the moment just to kind of help give you more recruitment ideas. In particular, Neil Eastwood, who many of you will know, he's a kind of social care recruitment guru, and he's opened up his recruitment masterclasses for free. And I think they'd be really helpful. Lots of advice about recruiting from your local community, lots of advice about how to make sure you don't lose staff after those first few weeks. So do have a look into that. And next one, please, Peter. Social media, a great way of raising the profile of your service, particularly in relation to recruitment. It's free, you get instant engagement, and there's a skills for care guide that can just talk through some of the different options, how best to use them, and just some best practice examples. So that could be worth a look. And I think the next slide is about Care Friends app. Trying to remember, yes. So we know that employee referrals are the most successful means of recruiting new staff. I think about 36% of all new starters come through employee referrals, and staff who come in this way are more likely to stay with you as well. And there's an app which has been developed, so if you may have this already, it's just a way of making sure that your employee referral scheme just remains at the top of everybody's priority lists. It kind of gamifies the whole process, makes it a lot more engaging for staff. So do have a look. You can request a free trial just to see if you think it would work for your organisation. I'll skip over this slide because you can read through that once you get the slides. I'm very conscious of the time. And Selena mentioned we have a lot to help you with meeting CQC requirements. And this is a link to our website where everything can be found. And particularly helpful is a guide on delivering good and outstanding care. It's quite a large document that just goes through each of the Chloes in turn and lets you know what you need to be doing to achieve either good or outstanding against that particular Chloe. I'm not sure there's any more slides. I think there's one in a moment with our contact details on. Our deputy manager network, which Selena has mentioned already, and do let your deputies know about it. It's fairly similar to this, just a chance to get peer support, talk through challenges, and also hear from external speakers as well. Moving up programmes, so this is aimed at Black, Asian, minority ethnic leaders who want to take the next step in their career. You can find out more on the link on the slide, and it's likely this will be subsidised by funding this year. So if you're interested, speak to myself or Selena and we can let you know a little bit more about that. This actually is the final slide. So mine and Selena's details, anything you need support with, whether that's recruitment, workforce development, any intel you want us to pass on to the CQC or the Department of Health and Social Care, please get in touch. And you'll get sent these slides or you'll be able to access them from the LCaS website. So you'll have the links to everything I've spoken about. And I've just seen a question in the chat from Nigel. I think it's up to you as the manager whether the person still needs to do the care certificates. If you're happy that she's got kind of sufficient knowledge, then no. But if not, she maybe may want to do kind of parts of the certificate, not necessarily all of it. Are there any questions about anything I've spoken about at all? Sorry, that was fairly rushed.
No, I mean, I will add in, Laura, that Skills for Care provides so much information for the sector across all areas. Their website has got a raft of information, but we have Laura and people like Selena who can put you in touch with specific areas within social care that you may want to go and look into. So it could be learning this or anything like that. It's really important to actually follow up with skills for care. There is lots of templates as well that you can use within your organizations, which are really helpful. It will save you a lot of time. Their supervision, part of what they do, supervision, is really great as well. So I would use that as well for your staff as well. So there are a lot of things that Skills for Care do provide. So I know Laura will probably signpost you to many things, but yeah, please do look into that as well. And as Peter would say, it's all free.
Okay, that's very useful. Thank you very much. Any more questions for Laura or for Dudley or for myself? That's good. You're all very quiet and well behaved today.
Okay, well, very quickly before everyone leaves then, I have put in the chat box, LCaS do provide, if you can sign up to the newsletter, we do, I would say daily, but weekly updates of the things that are happening in the sector, the headlines of all the things that are going on. We know it's forever a changing place. We don't expect everyone to be listening every 5 seconds to what's going on. So please, if you do sign up, you will get the updates of what's been happening. We also will be sharing information like today's event today and various different webinars, training, information for local authorities and updates that we try and do on a regular basis. Peter does also get to meet with CQC regularly as well. So some of the issues or questions that you may want to raise, you can book and part of a WhatsApp group, which we do have running as well, which you can raise concerns. And also, one thing I always say, as Peter says, we are all experts here, so we can share information and knowledge which can help your fellow colleagues as well. As we know, as a sector, we have to stick together because it's very difficult times. So all the morale and useful help that we can share for each other, it's great. I always will say check and make sure your well-being is most important, not just for yourselves, but for your staff as well. It's really key to get through. That will, I will say, we share as well. And everyone, if you are going out to all these new events and things like that take place, stay safe and secure as well.
Okay, just a few final things. I've put two, if you want to know which WhatsApp, if you send an email to Dudley, he will sort out your WhatsApp, joining you to the relevant WhatsApp groups. I've put two webinar sets of details in the chat. One is the Care Homes Patient Safety Network. That's a Zoom. And also there's a webinar later this week by a solicitor partner from Lloyds Withy King, Mei Ling Huang, who is very good. That's about risk. So they're both, I know it's all time, but if you are available, do sign up for those. And there's the newest edition of the e-magazine Driven by Health with Care, which will be useful for you. And any last final points or questions, apart from saying thank you very much? We will be in touch. The next, October meeting will be about wellbeing, health for the staff. And in November, we believe that we'll have Mick Feather from Citation, which is always popular. So let us know what you want and we'll see what we can do.
And also as well, everyone, I know the biggest concern apart from vaccines is going to be retention and recruitment. Please do what you, Skills for Care have given you certain things you can look at. Please do talk to one another, look for new resources as well where possible. Yeah, please, everyone take care and thank you for coming.
Yeah, and if we did extend this from an hour and a half to 2 hours, would that work for people, or do they want to stick to 90 minutes? Let us know. You know, we'll go with it. Okay.
Thank you.
Thanks, everybody.
Enjoy the weather whilst you can, everyone. Take care.
Cheers now. Bye now.
Bye.
Thank you. Bye-bye.